Hi, and welcome to Fairview Range. I'm David Hall. Today we've got a really exciting show because we're on our campus here in Hibbing at the Fairview Range Medical Center. And we're out in front of the Medical Oncology, Chemotherapy, and Infusion Center. So we're going to have the opportunity to go inside, take a peek in there, and then we're going to sit down and talk to a couple of individuals we'll introduce to you in a second. So let's go inside. All right, here we are in the Medical Oncology Center. This is a new facility. We just moved into this just a few weeks ago. So it's such a great opportunity to be able to show it to everybody on our program today. So you kind of get a sense for the layout here, and there's all private rooms. So we're going to go into one of the rooms here in a minute, and I'm going to be speaking with Dr. Privadas, who is a medical oncologist and the medical director for the facility, and and Kim Pettinelli, and she is a nurse practitioner. And so there are two guests, and so we're going to go into the room and visit with them. So why don't you join us? Okay, so let's start by having a bit of an introduction,
Sure.
A little bit more background about each of you. Dr. Privadas, maybe you can tell us a little bit about your background and who you are.
Okay, my full name is Dr. Anastas Provatas. They call me Stas for short. I grew up on the East Coast in Connecticut and went to school out east, a small school called Wesleyan. Also went on to University of Connecticut School of Medicine, and then did some residency training at a Yale-affiliated hospital in Connecticut, and then went on to oncology and hematology training in New York at Albert Einstein Cancer Center. Okay. And basically ended up here, recruited by the U, and love being here and taking care of patients here in the range.
Mm-hmm. So medical oncologist. So right. For those that maybe don't know, tell me, what does oncology mean?
Well, oncology is it's actually, it's a Greek word. Onkos is tumor, and it's actually means the study of tumors. So basically it's oncology, oncologists are trained to treat, diagnose cancer patients, as well as manage their care throughout the continuum. They're also involved in the actual treatment planning in terms of what treatment is best for them. They're also involved with research in some cases, researching in patient in terms of what the best medication is for their treatment and so forth. Yeah. You mentioned the University of Minnesota. Right. So are you connected to the university in some manner? Right. I was recruited by the University of Minnesota. I'm actually on the clinical faculty. I'm affiliated with the oncology department there, and I deal with the faculty on a regular basis, and a lot of my decisions are based on a consultation with the faculty there. So. Okay. So would it be accurate to say if a patient receiving care here under your supervision is also have some of the protocols or supervision or from the University of Minnesota? I mean, there's some similarities there? Yeah, for sure. Yes, it's I'm on the faculty, as I said, so the patients that receive care here are receiving cutting-edge care that's been researched and presented at the university, and basically I'm an extension of the university, and I'm actually employed by the university. Okay, so, great. An extension, that's it. And so really it's almost like having the university on the range here. So, okay. So wonderful. People don't have to go down to the cities. Right. Well, and I think especially for people having cancer treatment, travel can be a challenge, no doubt. So that's what a great thing for the patients. And it's definitely a positive thing for the patients. And as I said, I always consult with specialists. I am an oncologist. I'm a specialist in all areas of oncology, but some oncologists specialize in lung cancer and prostate, and I can consult specific specialists at the university when I need any help in terms of treatment. Okay, excellent. Okay, thank you. Sure. Kim, why don't you tell us about your background?
Yeah. I went to Mankato State School of Nursing to receive my bachelor's degree. Received that in 1994, and then worked as an RN, a few different areas, and then worked in oncology for about 13 years. Decided to go back to school for my master's in nursing, and along with my nurse practitioner certification. So I received that, and then I worked in family practice for about 3 years, and then started with Dr. Provatas here in Medical Oncology again about 2 years ago. Okay. So back to where I want to be.
Okay. So
and she's been a great asset. I mean, she's really intelligent and competent, and she's really makes makes my job a lot easier.
Well, that's good.
Good.
That's right. Yeah.
Well, help us understand, Kim. I mean, as a nurse practitioner, you're working very closely with Dr. Provatas, obviously.
Yep.
How does that relationship work? I mean,
You know, Dr. Provatas, he actually sees all the new patients in consult. So they will see the oncologist first for further testing that may need to be done. Once a patient is diagnosed, and then they'll see the patient. He'll see them for treatment planning. Once their treatment is initiated, then I may see them, prior to subsequent treatments. We kind of share in that. I do see a lot of follow-ups. We follow people for an extended amount of time, once they've been diagnosed with cancer. And once they've completed treatment, we still follow them for quite a long time. So I help him with that too, with seeing patients and follow-up too. And then, different acute things that might arise, I can help them out with that too.
So when patients are in the infusion center here, chemo center, are one of you always present or in the building? How does...
Pretty much there is one of us here,
Okay.
5 days a week. Very occasionally, it might land where we both are gone, whether somebody's sick or maybe a vacation, but that's very, very rare. Usually one of us is here.
And usually there's phone coverage or
Yeah.
backup from the university as well. But
Okay.
we try to have a provider here 5 days a week, and I know a lot of times a lot of us answer calls after hours and are available as
Right.
well.
Yeah.
Right. Okay.
So I try to treat the whole patient. So I consider them a family member. So I almost dedicate myself to their care. So that's what. Plus, both me and Kim are very dedicated to our patients. So that's the most important thing.
Yeah, well, that's a great thing, and I've heard that from
Yeah.
some patients that you have treated. So I think that it comes across very well in that regard. So that's a great thing. So tell me a little bit about the types of patients that are treated, types of cancers. That you see.
Well, we see everything pretty much. We see lung cancer, we see colon cancer, rectal cancer, prostate cancer, also the lymphomas, non-Hodgkin's and Hodgkin's. We see melanoma, breast cancer, of course, and those are the major ones. But we also see some rare tumors like sarcomas, but usually we consult with specialists at the U when we see some rare tumors, and so we see everything, and we try to we do our best to make sure they respond to treatment and get the best care.
Okay. Now, I know we also have a radiation therapy center here on our campus. Can you help us understand the connection between radiation center and oncology here? Is that you work closely together? Or?
Yeah, I work with Dr. Paul Lindholm. He's the director of the radiation center here at Fairview Range, and we're always on this phone together, consulting about cases before we make a treatment decision. And a lot of cancers do require combined radiation and chemotherapy.
Right.
So a lot of lung cancers, a lot of rectal cancers, anal cancer.
Head and neck cancers.
Right. So that's a great asset too about Fairview Range, because they can come here, see the radiation oncologist, and also see the medical oncologist, and at the same time without having to travel somewhere else.
Right. Good. Okay. Kim, maybe I'm wondering about, from a referral standpoint, could you kind of describe for us a little bit about maybe a typical kind of a scenario as far as when someone might be diagnosed, and does that occur with their family practice physician, and how does the referral process work and so forth?
Truthfully, that really varies. Lots of times it is from primary care. Maybe they're, for instance, with breast cancer patients, they might be seeing their GYN physician and have a mammogram completed, with their yearly physical, and something is found. Lots of times in those cases, in lots of cases, even from primary care, the patient may be referred to a specialist, whether it be an ear, nose, and throat specialist for further evaluation, or a breast surgeon, or one of the general surgeons for colonoscopy. And then from that standpoint, it usually is where, when the patient has had a biopsy and has the actual cancer diagnosis, that's when they will actually get referred to Dr. Privadas, is when they have that actual diagnosis.
Okay.
Sometimes there's certain things that might be a little questionable, that maybe the surgeon or primary care is not quite sure about, and then he might further evaluate, do further testing to really find out you know, about the cancer.
Mm-hmm.
So.
And a lot of times we also get second opinions from other
Okay.
Oncologists who want, or patients want a second opinion that don't necessarily agree with the plan. So we're getting a lot of referrals from other oncologists as well who are willing to, who have seen patients elsewhere and they want patients treated here. So we take over their case and manage their care.
Okay. Now I know that the location where you were previously located that you did was in the clinic, and now we're in this beautiful new facility here, which is wonderful. Can you, Dr. Provatas, tell us a little bit about why did you move, and what was the advantages of moving to this new location?
Well, we're really excited about this new center. It's really at least 5 times larger than the other facility. And to be honest, the patients were in one room, and now they get almost individual attention. They get their own private room, their own television, their own bathroom, and the nurses get more one-on-one care. And to be honest, I can pop in and see the patient in a private manner. In the past, the patients were all in one room, and it wasn't very private, to be honest. But so that's definitely a plus, and the patients love it. And I think, in one sense, the nurses being in one facility, we're all more of a family, I think, that we can talk to each other. And in the past, we were kind of separate, and it wasn't really the ideal situation. I mean,
Kim, it seems like a lot of times when patients come for chemotherapy, they don't come alone. They come with a family.
Family or
Can you
friends,
speak to that, and I guess, again, what the impact the new location has had on
Yeah,
that?
you know, in our previous location, it was pretty small. You know, we had enough room, you know, to treat 4 patients, and we might have a couple extra chairs, and that was pretty tight. So when patients did want to bring family or friends with, it was pretty tough. You know, up here, the rooms are so much larger. You know, not too long ago, we had a patient, and I think he had close to 10 people in there with him. They had lunch, they had, you know, so lots more room for people. Just to have that, you know, to be able to do that here is huge for them.
How important is that to you? I mean, from a clinical standpoint, how important is it for families to be involved for the support of the patient?
Very, very important. Yep. Their psychological well-being, it's a whole part of their treatment, it's a part of their healing, it's huge.
Dr. Provatas?
yeah, I agree. The family needs to be involved in the patient's care, and we try to accommodate their questions and answers. And a lot of times they have a lot of questions. It's a lot easier to just talk to a family in a private room as opposed to a room where there's other patients and you can't really discuss private matters. And the family, like Kim said, is important emotional support. And you know, I always look at the glass half full, so I'm always presenting a positive look because we know we're trying to treat the patient, but we also have palliative care that's available, and we can also talk to families about that as well. So.
Okay. I'm not sure everybody would understand, but maybe palliative care, maybe you could describe that just a little bit.
Well, it's I don't know, Kim's been involved in it. It's more of a way to help patients cope with, a lot of cancers are treatable but not curable. So, you know, so a lot of patients, you know, we try to be honest up front, and we know we can treat the cancer, maybe extend their life, but we're not going to cure them. So palliative care allows them to have that interaction with a nurse at home and be prepared if indeed we don't cure them, or at least, you know, extend their life, that they may transition to, you know, something else. But I don't.
Kim, anything you want to add to that?
No, that's exactly. It's a great program.
Yeah.
For people,
And I
for
think it's a great
families.
program. So
really good for the patients and for the caregivers. It's huge. It's an extra support. You know, they have our support here, and they have us, you know, their access to us, but it's a whole nother support system that they're given, you know, and they have 24-hour access to that support system. And that's one of the big things for people to know. They have that, you know, that availability to talk with someone, you know, not just someone in a different, you know, from the ER, you know, but somebody that is involved in their care is huge for them. So it's good. It's a great program.
I know, I mean, over the years, we've heard from patients and families about the value of getting care close to home. And again, travel being a concern or an issue. Is that a big advantage from the standpoint of treating cancer, of getting care closer to home? I mean, from the standpoint of, I mean, even just clinically speaking, is there nausea issues and things of that nature that close to home or is a big advantage?
It's definitely a big advantage. I mean, I feel like they get the same great care they would get in the cities because we have the expertise, we have the team here, and we're always available to answer their questions. And a lot of times, people that have gone elsewhere come back here because of the travel involved, and a lot of times, they could get sick on the way, and it's a lot better to deal with everything here.
Sure.
So I think they get the same care they would. Either here or even in the Mayo, and we do consult with Mayo physicians occasionally, and I have a one-on-one relationship with a lot of Mayo physicians, so they can get care here that they would, let's say, a Mayo physician would prescribe to them. We could offer the same treatment here.
Almost a co-management,
Yeah.
Which is really nice for people.
Okay.
And I think our names are recognized in the cities already. So I've been here almost 6 years, I guess, and getting well. So it's and the community has gotten to know me, and patients gotten to know me, and so word of mouth is important too.
It is,
and that's helped a lot too.
Good.
And we all have had successes in treating patients, and they appreciate that. And
Good. Kim, give us a sense for if a patient were going to come in for chemotherapy, what can they expect? I mean, what happens when they come? And
Okay. Before their treatments, their treatments can be scheduled. There's just varying schedules. Somebody, for instance, who might come for chemotherapy once every 3 weeks. What we do is we have them come in, they will have their lab work, and then they will see either I or Dr. Privadas, and then chemotherapy. So that's the ideal, is to have them come and have that kind of all in one visit, basically. There are sometimes where we'll have maybe them being seen and have their lab work done maybe the day prior, and then they'll come for their treatment the next day. But that's usually how it works out. They're pretty much all the time, depending on what type of chemotherapy they're actually getting, they're seen by a provider. So.
Okay. And is there a common or a typical regimen with regards to X number of times a week, and they're here for X number of weeks, or is it just?
It really depends on the type of cancer, the different chemotherapy they may get, the different schedule, So it can be, once a week for 3 weeks in a row, and then have a week off, and then start all over again. It can be once every 2 weeks. It can be once every 3 days in a row, every 3 weeks. So they all really do differ. Everybody's.
Yeah, there's just like she said, there's a lot of different protocols that we use, and some are like daily, and they have to come in 5 days a week, and some 3 days a week, and but we always accommodate them, try to fit them into their schedule, so we can prescribe the treatment that's indicated.
What about age? Is there a particular, you don't treat below a certain age or over a certain age?
Well, I think age is just a number. I think there's a lot of healthy 80-year-olds that look like they could be 60. So
Amen to that.
Yes.
Yeah.
So I look at the biologic age as opposed to, so we can treat anyone pretty much. I mean, depending on their health status. But obviously, if their health status is poor, we try to pick a regimen that's not as harsh on them, but still can treat them. But if they're a young 80-year-old, we kind of prescribe the indicated, and there's been studies that show that biologic age is more important than the actual age.
Okay.
I mean, technically, I was trained to treat adults, so anyone over 18 ideally is what I treat. But occasionally we've seen some younger patients for hematology type issues, which is blood disorders and things like that.
Okay. Yeah, and that's a good point, because in this new unit now, you're doing chemotherapy, but you're also doing infusions. Can you speak to that, Dr. Provatas, as far as what types of patients or what's occurring?
Oh, yeah, we also deal with non-cancer patients as well. We deal with anemias and people that have iron deficiency. So we're giving a lot of patients have had gastric bypass procedures, can't absorb iron, so they have to have IV iron, and we infuse that, and also fluids and if they're dehydrated, we try to keep them out of the hospital if we can, and try to do as much as we can here. So we try to avoid that and try to avoid them going to the emergency room if possible. So we do infusions, fluids, antibiotics, and I think some other providers also prescribe other medications as well.
Okay, so a lot more going on in this unit
Right,
than just
right.
chemotherapy.
Right,
so,
right,
okay.
right. I think the rheumatologist is prescribing some, arthritis type drugs.
Okay.
So, like, I think it's what, Remicade and.
Okay. Good, good. Now, I also want to ask about the Commission on Cancer.
Oh.
I've heard a lot about them, and I know that, can you help us, who is that, and how does that affect your unit?
Well, it's a national entity that has set up standards to provide quality care for cancer patients, and a lot of national institutions are actually members. Like I think Ohio State is one, and the Fairview Range has been accredited, and we have to keep our accreditation up. So we have to follow certain rules. Among those are, in terms of diagnosis, having to provide certain pathologic studies. We keep a record of patients' care in terms of survival data, and we try to keep up our standards to the national level. So the fact that we're accredited, and I'm also a cancer liaison physician, which I was appointed, which allows us to keep up with the national standards. So we're getting actually better care here than we would, let's say, in a small hospital or somewhere else.
Okay.
We're actually getting care that's equivalent to Ohio State or the Mayo Clinic, which they're all, I think, CLC accredited.
So that Commission on Cancer, those standards are the same here as if the same standards apply at Mayo Clinic or Cleveland Clinic.
Right,
Okay,
Cleveland
great.
Clinic, yeah. And they're getting excellent care, and we have to maintain those standards to keep the accreditation. So we have meetings with the Cancer Committee almost monthly, and we try to keep up with those. I present data that has been abstracted from our database and compare it to databases elsewhere in terms of survival data, and see if we're keeping up with that. And also in terms of, like, I know for surgeons, there's a certain protocols that they have to obtain a certain number of lymph nodes before we can diagnose them as a certain stage. So we try to keep the staging protocols as national standards. So we're really really getting top-notch care here, and we try to keep up with it so we don't, because oncology is constantly changing. So every year it's a new protocol, new standard that we have to keep up with, and we try to keep up that accreditation.
Good, good. Well, it's good to know. I know that's a lot of work that puts you through that to achieve that.
And we have a registrar that helps us too, so she's been excellent.
Okay, good. Just kind of in conclusion, I think, as when you look at this unit and the services that can be offered, is there anything that you feel like that really sets us apart as Fairview Range and the chemotherapy that's being offered here and the treatment and care? Anything that really you feel like kind of sets us apart?
Well, I think the fact that we get a provider here 5 days a week. I mean, other programs don't have a provider 5 days a week. And the thing that I would like to think is that we provide compassionate, competent care here, and the nurses are totally involved. They're very caring. They're constantly calling patients and making sure they're doing well, and there's a constant attention. So they get like almost 24-hour care here.
Yeah, nice.
So 5 days a week. I think some of the other local facilities, they may have a provider like 2 days a week or something.
2 days a week.
Okay.
So I think we're almost becoming a center here for the range. That's our goal.
Yeah, good, excellent. Good. Anything you want to add to that, Kim?
No, that was good.
Okay, good. Well, I know it's so often the case, the personal care and attention people receive from the patients and family is huge. So that's what I really hear you saying, is that special attention they get, as well as knowing that the care that they're receiving and is at the highest level and to the same standards of University of Minnesota and Mayo Clinic and others. So that's really great to know.
Yeah, we always try to call patients when we have results and try to be on top of things, and so they don't be, a lot of times they don't know what their results are.
Sure.
And we're always on top of that.
Well, thank you both. It's been really fun to. It's always fun to come up here and see the actual space and the new, especially new units. It's a beautiful new facility. And we're grateful for your time. I know you're in the middle of taking care of
Sure,
patients today,
sure,
so appreciate
yeah.
you taking the time to do that. So I want to thank everybody for watching today, Fairview Range Focus, and I hope you enjoyed it. I hope you learned a little bit about the services that we have to offer here. They're quite impressive and fun to bring it here and show a little bit more to you today too. So thanks for watching, and watch next month for another Fairview Range Focus.
Hibbing Public Access Television would like to thank U.S. Bank for providing us with studio space.